Hi, I'm Dr. Sridhar. Welcome to my channel. In this quick video, we will be discussing what a suppository is, and we'll follow up the next video on when we should consider using it. So there are many different forms of medication administration. So we have the oral form, which can be a tablet or a pill, as we say, capsule, and it can be the liquid forms like the syrups or the suspensions. We have the injectable forms, and they can be given as intramuscular injection in the muscle, as a subcutaneous injection, and it can also be given intravenously, especially in hospitalized patients. And we have the suppository form, which is usually inserted into one of the body cavities, usually the rectum, and it's called rectal suppository. And we have vaginal pessaries, and we also have urethral suppositories. So there are different situations when a suppository can be useful. And what exactly is a suppository? It's a formulation where we have a vehicle. Usually the vehicle depends on whether the medication is fat soluble or water soluble. So the suppository is a formulation where the medication is carried in a vehicle, which is usually cone shaped in the case of a rectal suppository, with a slightly pointed edge, not sharp of course. And the vehicle can be hard fat, it can be glycerin based, it can be cocoa butter based, and it can also be polyethylene glycol based. So polyethylene glycol based is water soluble base, and the hard fat and cocoa butter are fat soluble bases. It either melts in the rectal temperature if it is a fat soluble form, or it dissolves in the rectum, resulting in absorption if it's a water soluble form. The medication is not exactly equally mixed within the suppository, so it can be differentially distributed. So cutting the suppository in half usually is not going to result in adequate drug level if you are aiming for specific levels. So what are the situations where a suppository is used? So it's usually used in situations where the patient is not able to accept oral medication, an unconscious patient, a sleeping patient, a patient who is vomiting, or it may be because you're treating a local problem like constipation or inflammation in the rectum as an inflammatory bowel disease. So these are the various situations that you can use a suppository. How do we insert a suppository? It's fairly simple. So it's usually a soft surface, so you can leave it in the refrigerator normally so that it stays firm and it doesn't melt. When you take it out, keep it for a few seconds outside so it becomes a bit soft, and then you can insert it into the rectum. If it's a baby, you lift the thighs up and you push it and then hold the thighs together so that it stays in and doesn't get pushed out by the straining. If it's an older child, you can lay them on the side, lift the upper thigh forward and then insert the suppository. Again, hold it for some time and request the child not to strain so it doesn't come out. It usually melts within 30 seconds to a minute. The advantage of the suppository, as I said, that it can be used in non-cooperative patients who are unable to swallow and so on. It also acts a little bit quicker. But do we need to use a suppository, or can we use a oral form preferably? We will discuss that in the next video. Thank you.